So, like I said, it's like looking for a long lost love. And when I saw this product, I said it immediately. I thought of all the times of the patients that I've encountered that had mid-foraminal stenosis or exit zone stenosis or vertical stenosis on the lumbar spine. And you nip as far as you can with a Kerrison, hoping that you don't break off the tip of a facet joint, or get in trouble and bang up the dorsal root ganglion. And how many times I knew that I had decompressed the patient in the entrance zone, but just was hoping that that would be enough, because I knew I was not doing a good job getting the mid zone and exit zone. I had one of my old instructors used to take a small skinny curette and try to peel off the ceiling, and that took hours. And I have seen a couple of nerve roots rolled up with that technique, and that was not something that I was very crazy about when I went out into my own practice. And so when I saw this technology and saw that I could run this thing out through a foramina and control the angle of the debridement, and plus it was irrigated, I'm thinking, my Lord, this is just too good to be true. I mean, I can't tell you or communicate to you how excited I was when I saw this. And so Bob was the first guy I called when I got home from NAS. I wanted to move on this immediately. But I've used it in every one of the described applications here. I do a lot of cervical myelopathy work, and man, it is so sweet dropping over the posterior corner there in front of the cord and the cervical spine. You can take down the end of the end plate. You can sneak it up behind the back of the cervical vertebra. You know, when you've got that situation where the ligament or the posterior longitudinal ligament is thickened and you just can't get that margin started, man, it is so nice to take down some of that vertebra to give you room to work. And then once you can actually see the dura and the cord, it's honestly about 2 passes and you've removed 2 or 3 millimeters of bone. It saves an incredible amount of time in cervical spine. And then another place that I use it almost daily is ipsilateral and contralateral foraminotomies. Being able, about 2 passes, you can take down the roof, open things up. And then as I've gotten more comfortable with the technology, I have started working on trying to file down the bottoms of pedicles when you get into that situation with vertical stenosis. You know, our answer before that has always been to jack the disc space up, but I've been able to file down some pedicles now and actually feel like I'm giving nerves more room. I have used it in situations to take down the lamina. It's handy for that. It's just amazing when you have it in your hands and you begin to trust it, the things that you start letting yourself do. And we'll talk more about technique and all that sort of thing, but there are just a lot of uses for this thing.